Thank you very much for having us today. So in this presentation, I'm going to present some work that has emerged from a Wellcome Trust-funded project and that I work on with Milne, who's also on the call and who's co-author on the paper and will be around later for questions. So our project, which is titled the Space Project, it focuses on, it's a study on empirical ethics of digital health technologies, focusing in particular on the development of new diagnostic tool for the early detection of dementia. Our overall interest is in the development of technologies for the detection of cognitive decline associated with the diagnosis of dementia, working with both experts involved in the development of such tools and with all the members of the public who might be potential targets of the tools. In the first half of this work, exploring academic and corporate projects developing new tools, we have identified a number of important categories and practices, for example, around the relationship between detection, diagnosis, and screening, and around the changing geographies of diagnosis associated with digital medicine. But what we're particularly interested in discussing today with you is the relationship between active and passive visions of telehealth and the associated roles of subject, patients, and users. Activity and passivity are key themes in telehealth. The development of digital health technology is, in fact, at least in part, supported by and predicated on the role of enabling active self-management of health and the realization of the ideal of the engaged patient. Narratives of digital health set out by proponents and developers therefore emphasize the potential of the tools to empower the autonomous health consumer through providing detailed real-time access to health data and ultimately shift the balance of power in medical encounters, as powerfully captured by Eric Paul's assertion that the patient will see you now. In the context of digital health, this focus on the engaged and even entrepreneurial individual bring to the fore the self-tracker, the engaged patient, or the quantified selfer, who collects, assesses, and makes sense of data about themselves using digital tools, genomic tests, and various medical devices. However, as Sharon and Lupton in particular have pointed out, digital health tools' emphasis on empowerment is also accompanied by analyses that draw attention to self-tracking as a in their words, quote, paradigmatic practice of contemporary surveillance medicine, contributing therefore to the discipline and monitoring of population through the extension of the clinical gaze. Such questions have further implications drawn out by the prevalence of modes of surveillance that relied on so-called passive data, mostly from wearables and home sensors. Passive data collection presents two important differences with the more well-studied case of the self-tracker. First, it extends to a broader set of activities and indeed embodied practices, which in many cases bear no substantial relationship to health and well-being, such as speech pattern, eye movement, and even metadata from interaction with devices. Second, and more significantly, passive data shift the focus from the user's active role to the potential of the device to operate in the background. So whereas the user of self-tracking tool is at least imagined, to be actively engaged with the process of gathering data about their performances, technologies for passive monitoring are valued precisely for their potential to unobtrusively capture embodied practice that elude the user's perception and attention. So this shift has been powerfully described by Zuboff in her work on surveillance capitalism, where she argues that the remaking of the subject of contemporary surveillance entail passive or unwitting acquiescence to the repurposing of everyday devices as tools for digital surveillance. In the case of dementia, these tensions between activity and passivity is often the site of distinctions between, on the one hand, digitized versions of standard conventional assessment, or tools like See Hero Quest, which you see on the right of the screen, which is a gamified cognitive assessment that simulates real-life navigation, but actually relies on the active user engagement and participation in the game. And on the other hand, technologies like MindStrong, an app that tracks swiping patterns generated by everyday engagements with smartphones, or even the applications described in the patent for the Google Home smart speaker, which suggest, quote, that the device may monitor households' occupants' movement patterns and compare these movement patterns with those associated with Alzheimer's disease. The system may infer a higher probability that the household occupant has the disease. The inference may be reported and or recorded for subsequent use in the system, unquote. So, this considerable interest that passive data are attracting in the field of digital health is further explained by one of the leading experts in the field, indeed the developer of the application that I cited before, MindStrong, in the following terms, quote, passive data offers several advantages to conventional assessments. First, they are unobtrusive, placing no burden on the subject beyond the normal use of a smartphone. Second, they are ecological, since the smartphone data is captured in a natural environment, unquote. In digital tools for dementia detection, this boundary between activity and passivity represents an important site of scientific and ethical flex, at which tensions between the laboratory and the ecological data are articulated, and at which researchers, developers, and users negotiate boundaries between acceptable and unacceptable forms of intrusive or intense behavioral monitoring. As in the case of Cognition, significant expectations have been attached to the collection of passive data, also like in the case of COVID, specifically to inform various aspects of the public response to the current pandemic, from diagnostics to public health. So, for example, researchers from the University of Cambridge have developed an app which uses AI to detect COVID symptoms from breathing and coughing patterns, while earlier on in the pandemic, Fitbit, the company, launched a study suggesting that the users' data from users' heart rate might usefully identify early signs of the body's response to infection. Google and Apple also periodically release what they call mobility reports, which use various types of data, from location history to map queries, to track community responses to lockdown. However, obviously, the most high-profile and widespread adoption of the technology for passive monitoring have been the COVID contact tracing app. The development and release of the apps have brought issues related to passive data, particularly around surveillance and privacy, at the forefront of the public debate. Google and Apple, again, have played a major role in shaping the response to the debate, with the release in May of their joint framework for exposure notification, which, among other things, uses a system of random rotating identifiers to protect users' privacy. Specific app users' relationships have also been encoded in the system through the design of the app, framing in particular like users' agency and autonomy as central to the enterprise of digital contact tracing, focusing on consent and data control. So when downloading the app, users are asked to give or deny consent to the activation of system for proximity detection and exposure notification, as we see on the slide. Furthermore, the main page of both of the apps, and here we have the two apps from Italy and the UK, include the option to disable the service. And it's the case of the UK app on the right is particularly interesting in this respect, as the very design of the feature suggests that disabling the service is not a one-off choice, as opting in or out, but their users have the agency to and the possibility to choose where and when to share their data on an ongoing basis. So as we were preparing to conduct home visits for a study on the early digital detection of dementia and carry out ethnographic interviews with older members of the public, which eventually became impossible for social distance requirements, the release of the contact tracing apps also presented us with a fascinating case study to explore how people view, negotiate, and engage with tools for passive data monitoring in their everyday lives. A study, therefore, adapted to capture the emerging landscapes for digital health under COVID. Between April and October, we conducted interviews with 32 individuals, participants aged between 50 and 88 in Italy and in the UK. The interviews were conducted over the phone for obvious reasons and were repeated 3 times to explore how people use the technology in their everyday life under the pandemic, their changing views of and use of digital tools for passive monitoring under COVID, and finally their use of and views towards digital health technologies more broadly. So drawing on these data, and in particular from on data from the first and second interviews, in the remaining of this talk, I'm going to explore empirically with you how people negotiate activity and passivity through encounters with digital health. So the first thing that we want to present is the idea of becoming passive. But first, interviews more general and how people talk about the technology in everyday life. So when discussing technology and how they use technologies in everyday, participants usually mentioned, for example, using their smartphone to access and search, access the news and search for information about the pandemic, or to keep busy in lockdown, whether through downloading books, watching videos, or exploring the plethora of entertainment options that were made available in the first months of the pandemic in particular, from virtual museum exhibitions to live stream of concerts. Many also described, understandably, using the technology to keep in contact with the people they could not see in their daily lives, such as family and friends. What is particularly interesting is that contact tracing apps stood out as a quite different type of technology from these other uses, specifically where the other examples cited were about people actively using the device to search for information and to try and carry on with their life as usual as possible. In the case of contact tracing apps, it is the technology that generates information about users as they carry on with their daily lives. And so in the next part of the talk, like this, what we call this idea of becoming passive, I want to touch on how people sort of position themselves in relation to this new type of technologies for passive monitoring. A small number of interviewees who had downloaded the app or said they would focused on the additional protection that the tool could offer. So one Italian participant said that the app would help her to feel a bit safer, while another UK participant reasoned that it could help her to feel more confident about going out. So in our word, this is such an uncertain situation, and desperate though I am sorry, I lost the thought because I can't see it on the screen because I have my, view here. I do want a degree of control over what happens. And I think that this app would be a way to kind of ease us out into lockdown without this coronaphobia taking over. So for this participant, allowing the app to monitor her everyday activities meant to regain some agency over her life. This type of comments articulated a specific affordance of the technology, that of enabling users to take charge of their health by managing risks that, at least in part, elude their active control. However, Other participants were also quick to point out that the app did not, in fact, decrease their individual chances of being exposed to risk, unless obviously other people also downloaded the tool. The comment instead shifted the attention to the use of the apps as an act of social responsibility. Quote, I think if I used it, it would be sort of to be socially responsible more than trying to protect myself or my family. I think it would make me more paranoid actually carrying that and possibly getting notified of things that might not have happened. So both types of responses articulate different facets of the active users, but also complicates the ways in which activity has been commonly imagined and portrayed in digital health. In the first case, the apps are represented as enhancing or extending the user's agency and empowering them to return to a more normal life, but they do so by virtue of the user ceding control to the app. Specifically, the user relies on the app for detecting risks that elude their active control, while also assuming a position where, at least in principle, they accept to follow and act as instructed by the apps. So, from this perspective, the account of the app recalls Schul's argument that digital tools, far from producing autonomous active users, instantiate a relationship which she described as being, quote, between enterprise and submission, responsibility and discipline. This focus on social responsibility, as we have seen, was also often emphasized by our participants. And it kind of draws attention to another facet, as I said, of the active user, specifically the active contribution that each of us have been called to make to contain the pandemic by adopting the behaviors that protect not only our own health, but also the health of the others, particularly the more vulnerable, and our collective healthcare resources, as powerfully captured by the slogan, Save Lives, Protect the NHS. So these discourses draw heavily on popular narrative of participatory digital health, in which efforts to improve public health focus on activating individual health choices. As Erickson and colleagues point out, quote, while framed as patients' and citizens' empowerment, the promotion and use of participatory digital health tools and medical self-monitoring technologies can thus be seen as a medicalized form of responsibilization. These discourses, as we can see, were central to the app's vision, which framed the use of the tools users of the tool as active users contributing to the collective fight to the pandemic, and also shape their contribution through the participatory rhetoric of data sharing. In practice, however, participants' views of the app were contextualized in broader experiences of surveillance as being fundamentally beyond their control, and sometimes even beyond their awareness. So as one participant described it, I think the worry that most people have is that people are taking your personal information. And I think they probably are, but I think they are in most things when you're online, actually. So participants describe this relationship with surveillance, whether in the case of the apps or just more widely, in passive terms as something that they were subject to rather than participants in. As another participant described it, we are always localized. Even the tablet we keep at home is localized. So I don't see anything new about this. Then it doesn't mean that they're looking at us. But if I get the message asking me to review my local grocery store, then what does it mean? That someone knows I've just been there, right? It is the same thing with this app, I think. In the same way, participants talk about data as being released, accessed, leaked, stolen, taken, even lost, but not really as being actively shared, let alone controlled. Quote, there's no way back. Unless you throw away your smartphone, and then no one can touch you anymore. But even then, your data is already gone. As the quote indicates, becoming the subject of passive monitoring, at least from our participants' perspective, involved quiescent resignation more than active participation or even just active acceptance. From this perspective, one Italian participant explained, "We're controlled anyway. We might as well force people to be more controlled for the time being. If they want, they control us." Interestingly, a number of participants made similar comment expressing support, at least in principle, for mandatory enforcement of digital contact tracing, and in fact for even more passive forms of surveillance, such as tracking smartphones without owners having to download or consent to using an app. Interestingly, participants who decided not to download the app voluntarily also shared this type of views, particularly among Italian interviewees. I would have preferred that if it really was so important and necessary that it came from the government, and you don't have to download anything that it is mandatory once they had checked its validity and, how can I say, ensured all protections. I would have used the iron fist, so to speak. I would have made it mandatory so that it applied to everyone. In this case, while evoking the threat of coercion, the quote also highlights that measures should be in place to protect citizens, while also emphasizing the importance and need of enabling this type of data for public health purposes under these specific circumstances. So from this point of view, a number of participants compared the hypothetical enforcement of the apps to other forms of existing regulations, such as the use of face mask, restriction on personal movement, or the system of self-declaration justifying travel that Italian citizens were required to carry with them and exhibit outside of their homes during lockdown. These responses articulate a view of passivity, which evoke again ideas of social responsibility and even solidarity more than coercion. In doing so, they kind of problematize the dichotomous view of passivity and autonomy, suggesting that the two might be better looked at least in this context, as complementary rather than opposite. What it is at stake, however, what participants do take issue with is the notion of individual responsabilization and the view that public health is just the cumulative results of individual data practices, instead drawing attention to the wider social arrangements that make this data flow meaningful. So looking at these broader social arrangements, in the last part of this talk, we want to kind of take a closer look at what passivity is in everyday life and how this passive role is enacted in everyday practices, starting in particular from this quote from a UK participant. "Everybody in this village pretty much knows anybody who's had it. Everybody's pretty much been locked down, so I feel that I can rely on my own risk assessment, that they're relatively safe people to stay around as long as you're socially distanced. What it would be probably quite useful is for in a couple of weeks' time, I need to go to the nearby town to visit IKEA. In all of those places, the app would be quite useful." A number of participants made similar comments about the app being of limited use in familiar places, where the chances of meeting others were relatively low, and people personally knew those they came in contact with. In these circumstances, as this participant noted, participants felt confident they could rely on their own risk assessment and that they would become aware of possible dangers even without tools for automated detection. As we have seen in the beginning, a key feature of passive data is that of being ecologically valid, capturing how people act in the natural environment, in the real world. Participants' accounts, however, suggest that this quality of passive data is neither fixed nor external to this supposed natural environment, to this real world. Rather, it is contingent on the very practices in space that the tools are supposed to capture. Situated in everyday practices, passive monitoring becomes actually part of active engagement with social and spatial encounters with risk. What we mean by active here, however, is not the straightforward process of activation that proponents of digital health technology sometimes describe, where users are imagined to be made responsible or nudged by the app to act in a certain way. What we see instead is an ongoing negotiation of the user's agency in relationship to the app, to the digital health tool. Put another way, users are not made passive by passive monitoring. There is room for agency, but agency is no differently to the technology, always contextually situated and relational. Some participants therefore commented that their views on the app depended very much on their capacity to act on the information it provided, and whether they would be able to self-isolate it if instructed to do so. I think the problem that we've got, certainly in my industry, is that people are trying to work as much as possible. And if the restrictions get any greater and there's no financial support, they will be tempted to sort of go under the radar and carry on and do as much as they can. And I think they will be wary of using an app which tracks their movement. So in contrast with the earlier quote, where knowing about undetectable risk meant be able to return to a more normal life or go and visit IKEA, in this case, the opposite was true. More information about what could not be prevented or controlled was seen as potentially disruptive. Deciding not to use the app for these reasons, however, was not seen necessarily as an abdication of social responsibility. Instead, participants justified these choices in terms of taking active charge of their own behaviors instead of outsourcing risk control to the tool. A number of interviewees further elaborated on this relationship between the app and individual behavior as somehow being paradoxical, and they emphasized that the app did not enable them to act any differently to what they normally would, because to do so would also mean to expose themselves to the very risks that the app was supposed to mitigate against. In my view, it's useless to download the app if your everyday behavior, the way you relate to others, as well as others relate to you, is not correct. It's not respectful. If you carry on with your life as usual and don't care if you don't wear a face mask, don't respect social distancing, don't wash your hands, or you still cough in your hands rather than your elbow, then it's useless to have an app. For me, it is your behavior that is important and the responsibility you must have. So to conclude, what can this empirical investigation of passivity in practice teach us about passive data more broadly and passive visions of digital health, including in the case of dementia? As we have discussed at the beginning of this talk, similarly to other domains of digital health, users of passive monitoring technologies are often represented in rather polarized terms, as either subject of intrusive forms of surveillance, whose privacy and autonomy are dangerously under threat, or as active, engaged individuals empowered by the possibility to delegate detection and management of health risks to tools that are much more precise and sensitive than human perception and judgment. Social scientists in the field of digital health has already challenged and critiqued this kind of dichotomy in relationship to the use, the role of the active patient. What we wanted to start to do here was to problematize this idea of passivity and what passivity means. While ethical concerns around passive monitoring and privacy remain valid and important, our data suggests that the problem is maybe not passivity per se. In fact, what the interviews show is that the boundary between activity and passivity is a really blurred one, and that the two are constantly renegotiated in practice in ways that are not the straightforward result of neither some features of the technology nor of the individual agency of rational, autonomous users. It follows that reckoning with the ethical dilemmas around the role of passive users and passive technology cannot be reduced solely to the displacement of responsibility to individual users, nor to the design of the technology as somehow implied by the narrow focus on privacy, consent, data controls, rights while left to share your data. When looked at in the context of everyday practices, a key point that emerged from our data is that for passivity to be meaningful, it must lead to some capacity to act, even if in some cases this might simply mean to cede or delegate control to someone or something else. Thank you.